Good morning all. My name is Dr. Lilian Ohano from Vision Care Eye Clinic. I'm here to talk about what refractive error means. Refractive error simply means an eye disorder caused by irregularity in an eye, whereby it's difficult for an eye to focus on an image. Objects become so blurred and distorted. So what are the types of refractive error? We have what we call myopia, which is when a patient or a person cannot focus on a far image. We have what we call hyperopia, whereby a patient cannot focus on a near image. Objects at near become so blurred. We have what we call astigmatism. Astigmatism means irregularities in the shape of an cornea. So we have what we call presbyopia. Presbyopia is caused whereby a patient is unable to see a tiny print. It is caused by age. A patient that is prone to have this is from 40 years above. Some can get it from 35 years and above. What are the symptoms of all this refractive error I just mentioned? The most common symptoms of all this refractive error is blurry vision, 2. Double vision, haziness, headache, squinting. When you notice all this in your child or a person or your father, your sister, please try to encourage the patient to see an eye clinic. Most people don't notice this, but it's important to get a proper eye check regularly so that your eye doctor can do a comprehensive eye check on you. What are the risk factors of all this? 1, it could be hereditary. It could be hereditary in the sense that if anybody in your family wears glasses, you stand a chance of wearing it. So it's better to check yourself. You can just grow and you just have it. It doesn't have a particular thing. Most types of refractive error is myopia. Myopia mostly happen. The most common is myopia. Myopia mostly happen at children at the age from childhood. It could be preschool children or school children. So it's usually advised to get a proper eye check for us to detect these errors on time to avoid hard-eyeing. Another types of what am I trying to talk about is what causes these refractive errors. Refractive error, especially myopia, is caused when the eyeball goes short. As I said, is when the axial lens falls in front of the retina. Hyperopia is when the axial lens falls behind the retina or grows longer than the retina, for instance. Then we have another one is problems in the shape of a cornea. If the shape of your cornea is not in order, you could be prone to have astigmatism. Another one is aging of the lens. Once you reach 40 years and above, you find out that you find it difficult to focus on a near print. It means your amplitude of accommodation is depreciating. And always know that as you grow, your amplitude of accommodation keeps dropping. So that is whereby you find it difficult to focus on a near print. How is this refractive error detected? This refractive error are being detected through a proper eye check from your eye doctor. So it's advisable to get a comprehensive eye check from your optometrist. What are all these comprehensive eye check? The comprehensive eye check includes your checking of your visual acuity. It's from your visual acuity we could detect this patient has this or this patient doesn't have this. Maybe if you're able to, because the normal standard of reading is 6.6. So if you're not able to get up to this 6.6 standard, you could stand a chance of having a refractive error. But just know that it's not more than you have refractive. When you don't have up to 6.6 standard, it means that you have refractive error. Some of them could be pathological. So with the use of a pinhole from your optometrist, you know to state whether you have refractive error or not. What are the treatments for this refractive error? Refractive error could be treated with glasses or contact lens. Some could be used through surgery, can be treated through surgery. At the end of this, I'm going to point out some points to note down. What are these points I'm trying to talk about? point I'm trying to talk about is to educate us, is to encourage us to see our optometrist for a proper eye examination. 2, speak out when you notice some blurry vision, or you notice that you are squinting, or you notice that you have headache. All these symptoms I mentioned earlier on, when you notice all these things, try to speak out, because it's when you speak out you can know how to help you out. 3, try to encourage family members that have this history or they have the traces of refractive error to please go check their eyes and get a proper eye examination. Thank you so much. I remain my humble self, Dr. Lillian Ohano.